let's talk about this. We know that for seniors, one of the most important decisions they can make is about health care coverage. Medicare open enrollment is only open for a few more weeks. So how do you know what changes you need to make? Well, joining us right now, Dr. Rick Kratche from Iora Primary Care. He's our expert telling us what exactly seniors and their families need to know. So first, I want to thank you, Doctor, for waking up nice and early for us. So let's cover the basics first. How long does this open enrollment period go for?
So the annual enrollment period is a very important time of year for our Medicare folks. And so this period started October 15th and it goes through December 7th. So we're actually over halfway through it, about 3 weeks left in it. And it's really a critically important time of year for anybody Medicare eligible.
Absolutely, just a few more weeks left. So, Doctor, what kind of questions do you think seniors need to be asking, and maybe even their family members too, are helping them make these decisions?
Yeah. So it's really important for folks 65 years of age and older to sit down with an agent who's able to help guide them. Different things that they should ask about would be what it would be my total maximum out-of-pocket cost with the various plans. What are the copays? It depends on whether an individual has not only a primary care doctor, but if they need to see a number of specialists. What might the copays be for primary care? What might the copays be for those specialty visits? And even medications. Cost of medications can vary tremendously from one plan to another. And when you look at the cost of those medications over the course of a year, particularly for individuals who are on several different medications, that really can add up to serious differences.
Oh yeah, we know medication, treatments, all kinds of stuff, not cheap. Now, should people also be asking themselves what kind of changes maybe they've seen in their overall health? Could that dictate what changes they might need to make on their Medicare plans?
Absolutely. As we age, our healthcare needs change. Sometimes people develop new conditions, and based on those kinds of things, the insurance needs may change dramatically from one year to the next. For instance, somebody who's relatively healthy and develops a new condition may need a plan that's much more generous in their benefits. So that's huge.
Sure, and unfortunately things like stroke or maybe an injury or something like that really could make the difference in your overall health and could create kind of a long-term situation where you might need extra coverage or something like that.
And one of the challenges there is obviously none of us can predict the future, and we don't know what's going to happen in the next year. And the decisions that are made during the annual enrollment period, those plans will go into effect January 1st and then stay in effect for the entire next year. And so this is the one opportunity to do our best to predict and plan.
But you're right, nobody can predict the future. Yeah. So, Dr. Rick Kratche, thank you so much. Appreciate you being out here on Saturday morning.
Oh, it was my pleasure. Thank you for having me on the show. I just want to mention that if anyone wants more information on this, we have a website, www.iorainphoenix, IORA, and we hope that people will check that out.
Okay, we'll try to put a link on our main page.
That would be great.
Doctor, thanks. Okay, stay with us. We'll be right back, guys.